Good morning, Mr. Howe. I've got your medicines today. Mr. Howe? You doing okay? I think he's breathing. Code blue, help!
What's going on?
He's not breathing, he doesn't have a pulse. Okay, code blue. Alright, so Elizabeth, so continue doing chest compressions. Nick, let's get that ambu bag out. Let's hook that up to oxygen and let's do some good bagging. And then, great, Katie has the Zoll. I'm going to have you, Katie, do meds and the Zoll if you can manage that. And then Zach, go ahead and record for me. Keep time. Let us know when it's been 2 minutes. And then when we get to medications and different relations, let me know the timing for that. Ready? Here, I'll move the bed out. Great. Good. Moving the bed.
And then we have to roll to get an under
Right,
out.
pop back in that chest.
Alright. Great. Let's try to stay on that chest as much as possible. 10, 11. Okay. Great. Let's see what this rhythm is when we turn on the Zoll.
Looks like we are in V-fib.
Okay, it looks like we're in V-fib. Go ahead and stay on the chest for now, Katie. I'm going to have you charge it up. And you can go ahead and deliver that to
I'm
fibrillation when you're
clear,
ready.
you're clear, we're all clear. All right,
How many joules?
Back away.
defibrillated 200 joules for V-fib.
Okay, so that will be our first time here. Zach, let us know when it's been 2 minutes since our last V-fib. Okay, so Katie, knowing that this is V-fib, let's go ahead and prep some epi, and then also get 300 of amio ready just so that it's good to go whenever we need it. And then Nick, when you have a second, you can also take the headboard off to make it a little easier for you to bag. Okay. And then if you guys need to switch, Elizabeth, if you start getting tired, you guys can. Nick, go ahead and keep the mask on the patient's face so that we're still delivering oxygen while we're not giving breaths.
Rhythm checks in 15 seconds.
15 seconds, okay. Since it's 15 seconds away, Katie, go ahead and charge it up for me just in case. And then Zach, let me know when it's hits that too.
You're good.
Okay, we're still in V-fib. We can pause for a pulse check just because we don't have end title on yet. We'll get that on next. So go ahead and pause.
No pulse.
No pulse, okay. Go ahead and shock when you're ready,
I'm
Katie.
clear, you're clear, we're all clear.
Clear.
Defibrillated at 200 joules for V-fib.
Okay, let's go ahead and get that end title on as soon as possible. Resume compressions, please, immediately.
All right, hopping on the chest.
And then that was our second defibrillation, so we can give our first dose of epi.
Good compressions.
1 milligram of epi given with a flush.
30.
Okay, Zach, let me know when it's been 3 minutes since we just gave that epi. Okay, so we have done two defibrillations already. What is our
A
end
little
title?
bit faster, Nick. End title is 10.
Okay, end title is 10, so we still don't have a pulse, so we'll continue. What we'll do now, Katie already has some
30.
epi and amio prepared. We'll continue compressions at a rate of 30 to 2. We'll wait for our next 2-minute time. Are we getting close for our 2 minutes?
15 seconds for a pulse check. Just hit.
Okay, so we'll go ahead and pre-charge.
Sweet.
So stay on the chest as long as you guys can, okay? I think when it's 2 minutes.
Then 2 minutes. Alright, so we're still in B-fib.
Switch on next one. 18,
Alright.
20.
Again, I'm clear, you're clear. We all clear,
Clear.
oxygen is removed. Defibrillated 200 joules for our defib.
Okay,
I have your 300 milligrams of amiodarone.
great. Zach, how long until we're good for epi?
1 minute exactly.
Okay, so we'll give epi in a minute.
300 of amio given. Alright,
Okay, we have a rhythm change, but what's our end title
our
reading?
end title is 10.
Okay, so we're still in PEA, so we're gonna continue. Now we know we're in PEA, we're not gonna defibrillate anymore. We can still do an end title check every 2 minutes though, so Zach, let us know when it's been 2 minutes. And then we'll give that epi when it's time. We can start running through our H's and T's, so let's see if we're correcting. So hypovolemia, we could hang fluids if we wanted to, depending on this patient's status. Hypoxia, Nick, are you bagging okay? Does everything seem to be flowing? Okay.
Seems to be flowing all right.
Okay, so hypoxia we're taking care of. Hyper and hypokalemia.
Switch after.
We'll go ahead and send some labs to see what those result at.
You can now give epi. It's been 3 minutes.
Okay.
He does feel cool to touch. Super hypothermia.
So maybe we can warm him up a little bit. We'll check a temperature on him when we can, but
Okay.
Alright, 1 milligram of epi
All
given.
right, hopping on.
Alright, I see that the end title is now 35. Can we do a pulse check?
so
Alright, Nick, go ahead and
pause
pulse. We
compression.
can do a pulse check.
I feel a pulse.
Feel a pulse?
Okay.
Okay, good.
Great. Okay, so I think it's, what we'll do is continue to bag him because he doesn't seem to be responsive. Let's think about the rest of our H's and T's to make sure we're not missing anything.
Nick, can you get a blood pressure wire?
Yes.
Okay, so we'll get his labs and that will cover hydrogen ions. Do we know what his EKG looked like? Does he have a STEMI? If not, we'll call for EKG to come and get that. He doesn't have a history of any clots, so I'm not thinking that it's a thrombus. Toxins, I don't suspect that he has any toxins in his system. And then, since we were bagging okay, I don't see any tracheal deviation. I don't think that he has a tension pneumo. And then let's take a listen to his heart to see if he has any muffled heart sounds. And then we can hopefully rule out tamponade that way. So while Katie's doing that, Nick will get some vital signs for us. And then we'll get EKG. We'll send some labs if we haven't done those yet.
Heart sounds not muffled.
Okay, all right, so I'm not thinking tamponade. Okay, so he's still not responsive, so keep bagging every 6 seconds. We'll wait to get the EKG. We'll consider cooling him down now since he's not responsive and we're post-ROSC.
Go ahead and assess his lower extremities.
Yeah, do a full
See that we're
assessment
not
to make
missing
sure
any
we're not
bleeding.
missing. Nick, what was his blood pressure? Did someone get his blood pressure yet?
Yes, it was 85 over 56.
Okay, so 85/56 is a little lower than I would like, so
Pulses.
let's go ahead and hang some Levophed so that we can get that systolic greater than 90.
Okay, I have my lead head right here. We'll get that started.
Okay. Okay, so I think we're covered for now. We're covering our airway. We're gonna hang some Levophed to help that blood pressure. His heart rate is stable. It's a little fast, but that might just be because his pressure's low. I think that we're good to call for X-ray just to get an image, EKG. We'll wait for labs and then we'll wait for the expert consultation to come.
Very good.
We're ready for debrief after this?
Yep,
Yes.
definitely.
Good job,
Let's see.
team.